hepatitis is inflammation of the liver. Now, itis is inflammation. Inflammation in any part of the body is called itis. Now, hepatitis is inflammation of the liver. Now, there are various causes of hepatitis. We classify it as infection-causing hepatitis and non-infectious causes of hepatitis. Now, infectious causes of hepatitis, most commonly it is the viral infections which produce hepatitis, out of which there are various viruses called hepatitis A, hepatitis B, hepatitis C, hepatitis E and hepatitis D. And there are rarer causes of amoebic infections as well as bacterial infections of the liver. But the most common infectious cause of hepatitis is viral infections. Of the non-infectious causes of hepatitis, we have drug-induced hepatitis. That is, various medicines can produce liver injury. There are various lists of medicines which produce liver injury. That also includes alternative medicines like Ayurvedic medicines which also can produce liver injury. Then there is toxins like alcohol, which is a very important cause of liver injury, as well as herbal medicines can produce liver injury. Then there are some conditions where the body acts on the liver itself. They are called as autoimmune liver injury, that is autoimmune hepatitis. And then there is a condition where increased fat in the liver produces injury to the liver called steatohepatitis, that is fatty liver induced liver injury, that is called non-alcoholic steatohepatitis, that is fatty liver induced liver injury. So this is the classification of hepatitis. So we have infectious and non-infectious cause of hepatitis. Coming to the infectious causes of viral hepatitis, I already told the viral hepatitis is the most common infectious cause of hepatitis. Viral infections are A, B, C, D and E. Of this, viral hepatitis A and E is produced by contamination of the water we drink with feces of infected people. So it is called fecal-oral contamination. Whereas hepatitis B and C is transmitted by blood transfusions, sexual contacts or by injection drug abuse or from mother to child. So A and E are transmitted by fecal-oral contamination, whereas B and C are transmitted by the other routes. Coming to A and E, these are very common in India because there is lots of fecal-oral contamination that happens in India. So most of the hepatitis A comes in childhood, and so they get infected, they develop fever called prodrome followed by jaundice. So in case of viral infections producing jaundice, generally initially it starts as prodrome, that is they develop fever and body ache like any other viral infection. Once the fever settles, they start developing jaundice, that is yellowish discoloration of the eyes and urine. It happens in both viral hepatitis A and hepatitis E. Now A is more common than hepatitis E, and generally it comes in children and it comes in as a pandemic, that is the epidemic. So many children get at the same time because they all drink from school water, contaminated school water or somewhere in their house. E also comes in the same way. Most of hepatitis A and E is self-limited, that is they settle down with symptomatic treatment over 2 to 4 weeks. Coming to hepatitis B and C, they are transmitted, as I already told, via blood contamination or by injection drug abuse. They also have similar pattern, that is they have prodrome and they then develop jaundice. But the problem with hepatitis B and C is that they can go on to have chronic hepatitis B and C. A and E does not develop chronic hepatitis, but B and C can go on to form chronic hepatitis. The risk of chronic hepatitis is over a period of 10 to 15 years or even 20 years, the liver injury can happen in some set of patients with chronic hepatitis B and C, and they may develop the end-stage liver disease called cirrhosis. So that is the risk of hepatitis B and hepatitis C. Now of hepatitis B, if an adult develops hepatitis B, most of the time it is cleared from the blood, whereas if the hepatitis B enters the body during childhood, most of them, or during the first year of life, most of them go on to develop chronic hepatitis B. When it comes to hepatitis C, they don't develop jaundice very often, but most of them go on to have chronic hepatitis C. Coming to toxin-producing hepatitis, alcohol is the most important cause of toxin-producing hepatitis. Now, it is very rampant and very common. Now, alcohol induces liver injury by something called as free radical injury to the liver. By the metabolism of the alcohol in the body produces toxins which damages the liver. It is mild, it can be mild or it can be severe. Now, severe alcoholic hepatitis is a very grave condition. They can develop deep jaundice and even die because of the alcoholic hepatitis. Mild alcoholic hepatitis generally settles if they stop drinking alcohol. Now, the incidence of alcoholic hepatitis in the Indian population has been increasing over the last 10 to 15 years. They have the only treatment for alcoholic hepatitis is first to stop alcohol completely and then to take help from your hepatologist or your nearby gastroenterologist at the earliest. Alcoholic hepatitis can be treated and cured if they stop alcohol at the right time and take timely treatment. Coming to the symptoms of hepatitis, it may be very severe or there might be no symptoms at all. So most of the hepatitis A and E, as I already told you, presents with mild symptoms like fever, body aches, myalgia. After that, they develop jaundice. Whereas hepatitis B and C especially, may have no symptoms and you might just find hepatitis C on routine evaluation for some other diseases. So there can be no symptoms or there can be severe symptoms. Now some of the hepatitis patients develop what is called as fulminant hepatitis, that is the liver fails because of severe inflammation in the liver. This happens in a small subset of patients and they can develop severe problems and may need liver transplantation also because of what is called as fulminant liver injury, that is they go on to develop acute liver failure needing liver transplantation. So the spectrum of symptoms in hepatitis can be a very mild symptoms to very severe symptom needing even liver transplantation and may also lead to death. So how do you evaluate a patient of hepatitis? Now the investigations for hepatitis includes routine, the simple blood investigations and ultrasound scan. We don't need big tests, we need simple tests. Now the simple tests include a blood count and a liver function test. These are both blood investigations and there are some specific tests based on whatever infections or toxins that we are suspecting. Now for hepatitis B, C, A and E, there are simple blood investigations which will give us clue and get the diagnosis of viral infections. Whereas toxin mediated liver injury, especially alcohol, is based on patient's history, him telling us that he has consumed a lot of alcohol. Ultrasound is a must for all patients who are suspected to have liver injury and hepatitis because it gives us an idea about how the liver is doing and how badly the liver is damaged. So liver function test, basic investigations for the liver and ultrasound are the preliminary investigations needed for evaluation of hepatitis. Coming to treatment of hepatitis, most of hepatitis A and E infectious hepatitis are self-limited. All we need to give is symptomatic treatment and some hepatoprotective medicines for some of them and good nutrition. Whereas when it comes to severe hepatitis or hepatitis B and C which has gone into chronic hepatitis, we need to give specific treatment. Now specific treatment is generally for chronic hepatitis B and hepatitis C. If it is chronic hepatitis B which is producing active injury to the liver, we have drugs, simple medicines which can be given to take care, to reduce or eliminate the hepatitis B from the blood. When it comes to hepatitis C, of late we have had very effective medicines which can cure the hepatitis C from the blood. So hepatitis C is a very treatable and curable disease today. So we can give only 3 months of specific drug for the hepatitis C and cure the disease. So when it comes to hepatitis C, whoever has got hepatitis C should immediately take treatment because it is curable. When it comes to alcoholic hepatitis, the most important part of treatment is stopping alcohol and good nutrition. Now, if it becomes severe alcoholic hepatitis, there are some specific drugs which helps to reduce the inflammation in the liver and treat the patient. The patient has to consult hepatologist and take the specific treatment and stop alcohol when it comes to alcoholic hepatitis. So as far as prevention of hepatitis goes, it depends upon what is producing the hepatitis. When it comes to viral hepatitis, clean food, good drinking water, purified drinking water, that is for A and E. As far as hepatitis B and C goes, when it comes to blood transfusion, you should make sure it is screened for hepatitis B and C. Drug abuse has to be stopped immediately or should not be ventured into. And when it comes to alcoholic hepatitis, stop alcohol or moderate alcohol intake is a must. And when it comes to drug-induced hepatitis, you should consult your doctor and take specific advice and know about which drugs produces what kind of injury, so that if there is any symptoms, you immediately consult your doctor. And as far as NASH, non-alcoholic steatohepatitis, that is fatty liver-induced hepatitis, good nutrition and prevention of obesity and metabolic disease is the treatment for non-alcoholic steatohepatitis induced liver injury. Weight reduction and prevention of obesity and treatment of metabolic disease is the treatment for NASH induced liver injury. Thank you.